They say that half of today's 5-year-olds will live to 100.
10,000 to 12,000 people are turning 65 every day in the U.S.
So we just don't have a workforce to really meet the needs of an emerging aging population.
Caring4Cal was one of those unique programs that we were able to develop that worked on the workforce, developed the workforce, upskilled the workforce, trained individuals who were either helping their family members who wanted to work more with that population to help support them in their home settings.
I think people need to understand. I think when people think of healthcare, they think of doctors, nurses, and caregivers. It's more than that.
People can start off as a caregiver, but this is the one field that there is so much opportunity and growth for somebody. They could start off as a caregiver, move into a home health aide, a certified position, a nurse, even a doctor in some instances.
Caring4Cal gave us the opportunity to run not only one cohort, but we ran 3 cohorts of caregivers.
And it just so happens that the Caring4Cal grant was a grant that allowed us the funding to execute such a program.
And what happened is the program exploded. We actually had 4,000 people sign up for our caregiver training.
We had a mother and a daughter who are a graduate of one of the HCI grant programs, and both of them were becoming CNAs or certified nursing assistants. Those 2 individuals talked to us and came directly up and said what a difference it made in their life, that without this project, they would not have been able to become CNAs, and they also wouldn't have had the support to be able to continue and advance in their own careers.
Tomar este programa y ver las oportunidades que estoy obteniendo, sí es lo mejor que pude haber hecho. Es muy importante para mí porque esto me está abriendo mejores oportunidades de trabajo. Logrando esto, pues sé que puedo llegar más lejos y puedo también en el programa para estudiar el bien. Me siento bien orgulloso de haber tomado.
You never can see how much impact you are having with your work to others.
Y cuando agarré el curso aquí del programa de Caregiver, fue lo mejor, que me encantó, porque pude reafirmar lo que yo estaba haciendo y pude mirar si estaba haciendo algo no correcto o mirar si estaba bien o lo podía hacer mejor. Pude aprender de que había leyes.
When the people come to you and say, thank you, you helped me to open my eyes. I feel better, much better right now than before I start the class.
Para mi esposo, yo pude hacerlo como caregiver. Yo pude cuidarlo en casa. Yo pude hacer eso con mi esposo. Pude cuidarlo, pude darle los servicios que podía hacer una enfermera o en el hospital.
It's really important for quality of life that you're able to be in your home, you're able to be with someone that you know, and still receive the treatment you need.
So a lot of our youth are taking care of somebody at home. They just don't know that could be a career choice.
It wasn't something I had originally anticipated for my life, but I moved into my grandparents' house a few years ago during my sophomore year of high school because they needed some extra help.
We tap into the unpaid workforce as a way to deliver training and upskilling them so they have an opportunity to make it into a professional career.
It helped me learn more of the skills that I was lacking. Now I feel more prepared.
You give them the opportunity to be trained. You are also giving them the opportunity to improve their chances to be higher.
Your income level and how much money you have to pay for training should not limit you on what you can be. That was, I think, one of the most rewarding things with Caring4Cal was that we're able to allow individuals to really pursue it without the restrictions that they normally feel on cost.
Seeing that I was able to provide something that actually drastically changed the quality of their life was a really good feeling.
And that's what we wanted to do. Ignite the spark in healthcare and then see where they can take it once they get exposed to that opportunity.
By next year, we will have trained more than 4,000 individuals.
People saw an opportunity. They saw a chance to better their lives, to help provide better care, to be in a financially better position to take care of their family.
We wanted to make sure that everyone had the same access and the same ability to pursue their dream. We said, we see you, we hear you, and we want to support you. Cost is covered. What do you want to become? How far do you want to go? and HCI is there to really support that.